I was a physician liaison, and I would go out to these physicians, and they were finding it hard for them to go through and complete their MOC piece of those recertification. We were trying to figure out how we could help them with it. And we found out about the Portfolio Program and how we could help them do that administrative piece so the docs can focus on doing the QI work in their practices.
I'm the medical director for what we call the Ed Hub at the American Medical Association, which is our online education portal. One of the big burdens that physicians are challenged by is that EHR inbox. There are a lot of ways to manage that. Part of what the project is to help physicians choose one of 7 different ways to help to streamline their efficiency and decrease the burden of time so that they have more time to take care of patients. We're excited that they'll have the opportunity to select and figure out what works best for them.
You help them with the focus and some of the time, and then all the work they've been waiting to do, not just one project, but multiple projects, they're able to actually, in sequence, do that work and make improvements and see the results. I think that for us, the benefit that I see too is we're developing quality champions in our network.
We have a number of portfolio programs on that Ed Hub for people of different specialties to be able to utilize.
Our motto at Mayo Clinic is really to work to give the providers credit for things that they're already doing. So our organization works with grassroots projects that have come up and been developed by the individuals in their unit and collaboratively across the other specialties that they work with. And they bring them to us and we review them and make determinations about whether or not they're credit worthy.
I found that working with a lot of administrative assistants in the departments and the department chairs is a way that I really got physicians involved and found out who the education leaders are in each department, more so than maybe our QI office.
And it was really just making sure that all the silos were working together that were previously disconnected, communicating with all of our departments and divisions, getting a new website up and refreshed, announcing it to the enterprise.
I have a network of some of the portfolio people that I contact regularly for questions and how do you do this, best practices and so forth. So it's been wonderful.
Right when we started out, and we actually came to a conference that first year, and we met a bunch of people, different organizations that we've learned things from that helped us put the program together. So we kind of benefited from that relationship and from being among other sponsors.
We like the collaboration with the other organizations. We're not out there doing it on our own. And I think that's an opportunity for all of us to give feedback about what's working, what's not working. How do we best provide the service to those that need it to get the credit in the best way possible. We're noticing interest from departments that never felt that they had that place at Nemours to do their maintenance of certification. We also used an ROI equation to try to decide how much money we're saving the organization. So from September of last year to July of this year, we already have a calculated ROI of over $200,000 that we've saved the enterprise through our MOC efforts. So definitely saved our enterprise money, saved our physicians money and time, and nearly doubled our reach to be able to get them engaged in MOC. To be part of the program really is foundational to a service that you can provide at an organization level.
The impact is really profound for physicians and for patient care. So I think that the amount of effort to be involved in the development really has a very high payoff.